And next, Axios healthcare editor Tina Reed.
Welcome, everyone. Good morning. Hopefully the coffee has kicked in. I'm Axios healthcare editor Tina Reed, and I am thrilled to be here with you today, and I'm very excited about our program today, the post-midterms healthcare policy agenda. Thank you to our audience here in person. It's so exciting to be in person and virtually. You can follow along on Twitter with @Axios and #Axios events. Our first guest this morning is the Congresswoman from Illinois' 2nd Congressional District and the Vice Chair of the House Energy and Commerce Committee, Congresswoman Robin Kelly. Please give her a warm welcome. Thank you so much. Well, thank you so much for being here today. Appreciate it. So I wanted to start off our conversation by talking about something I know is near and dear to your heart, maternal mortality. Could you start off by just talking a little bit about the scope of the problem that you've been working to address?
To be honest, up until about 6 or 7 years ago, I didn't even know that it was a problem. I had no idea. I received a phone call from a constituent that happened to be friends with Judge Hatchett, who you see on television, and she shared the story of her daughter-in-law and son, and her daughter-in-law, well-educated, resourced, athletic, smart, on and on and on. She died in Cedars-Sinai in L.A. She already had one son, but in delivering her second son, she died from childbirth. And Judge Hatchett had a hard time in getting whoever she tried before to get someone to listen. So I got a phone call, and we immediately had a forum. I can't even remember what year now. I think it was in December in Washington, D.C., and so many people attended. We heard other stories, and that's really how we got started. And for Black women, they die about 3 times the rate of white women, and depending on where you go, like in Illinois, it's 6 times the rate, and Native women in Washington, the state of Washington, die at least 8 times the rate. So, and the sad part about it is 80% of it, the CDC has discovered is preventable. So it's tragic.
Can you talk about some of the practical solutions that you've been working on, and in particular that you're currently working on, and what its chances are of making it through in this lame duck session?
Well, one thing that we have been working on and it passed in the American Rescue Plan is to take the postpartum period that is covered from 60 days to a full year. That's what ACOG says is needed, and that would definitely save lives. I know people might think that it happens when you have a baby, but no, it can happen from when you have a baby or right before, all up to a year after. So right now, we passed it in the American Rescue Plan, but it's going to sunset March of 2027. But I'm frankly a little surprised. 33 states have taken us up on doing it in the District of Columbia, but we think every state should have to, it should be a must that all states cover, because it will save lives.
Now, everyone talks about maternal mortality as being a potential bipartisan rallying point, but Congress, because obviously there's still some issues. Do you think House Republican leadership will encourage collaboration on such things next year, or do you expect things to remain down the party line?
Well, I'm an optimist, or I couldn't be in this job. So I'm hoping that we can still get things done. In energy and commerce, we did pass some things out in a bipartisan fashion. My Maternity Health Improvement Act, Rep. Latta joined with me, as well as others, Jamie Herrera Butler, and that looked at best practices, because why is it that women deliver babies in a safe way in some places and not in others? Emergency room procedure. Then the other thing we think is important is bias training. It has been proven or shown that you do better when it's someone that looks like you, or at least understands the reality of your situation. So we were able to do that. So, we're working hard to, across party lines to get other people to join. And in some of the red states, as we like to say, that's where the problem is severe. But I will point out that Georgia, in their state legislature, they got some things passed.
Okay. And bigger picture, what are the chamber dynamics you're really expecting next session and the prospects for partisanship?
I'm sure there's going to be some partisanship, but I'm keeping my fingers crossed that this past election sent a message that there wasn't the red wave, it was a red twinkle, a little bit, and if New York maybe had done some things different, maybe some, things would be different. So I'm hoping that sends a message that the American people don't want the extremes wherever they're, coming from, and they want us to get work done. I'm hoping that, that's the message, but, we'll see.
Another issue that's been important to you is gun violence and mental health. Is there anything that can still be done within this lame duck session? And if the clock does run out, what specifically are you concerned might be left hanging?
Well, I'm very pleased that after 3 decades, we were able to pass some gun violence measures, and one that I really worked hard on, which was trafficking and store purchasing, because you hear all the time, Chicago has the strictest gun laws, but no one else around us does, so we have to deal with trafficking and also store purchasing. So that was in the legislation. We know there's more that needs to be done, and we'll continue to work on it. And this has been one of the worst years for gun violence. We like to talk about the mass shootings a lot, but my voice I bring to the table is the everyday one by one, which we deal with, in Chicago, even though they've had their mass shootings also, and you're not safe anywhere. That's what people need to realize, that, we're reading about it in places we never thought we would, read about it. So I'm hoping that more can be done, and it did pass in a bipartisan way. And as far as mental health, I think there has been agreement among Democrats and Republicans that we need to do more. COVID exacerbated the issues around mental health and trauma, and when you look at our, young people suffering and things like that. So I do think that we'll be able to move some things. And let me just say that Rosa DeLauro has been such a champion, as far as appropriations and working across the aisle. And I think actually mental health is a place where you will see more money.
And within this current Congress, or do you think that's something we'll have to wait on?
That we have to get straight right now.
Okay.
And I think so. And I believe that, like, even some of our community projects, that those will go forward, and various members, depending on where you are, money is going toward that also, because people do see it as such a need.
Another thing to touch on, clinical trial diversity, is a personal passion for you. Can you talk a little bit about what still needs to be done?
Sure. Well, we have our legislation around NIH clinical trial diversity, because what we see when in different clinical trials, it's not diverse at all. We were even very concerned about the COVID shots that people were getting, and companies, well, I guess Pfizer, Moderna, they were happy that I believe, they had at least 10% African American and even more from the Latinx population. But we want to see more done and more diverse clinical trials. We want NIH to work with the trial sponsors on really measurable goals and make it, match it up with the disease. Like you hear about, sickle cell and diabetes and heart disease more with African Americans. So we want to see more African Americans in the clinical trials. Of the top 10 diseases that Americans die from, African Americans are number one in about 8 of them. So we want to see more African Americans involved, and we want to make it easier, like once they go through the trial, to have easier follow-up. Sometimes there's not the access or the transportation, or you can't afford to take off work, things like that. So we want to see the barriers knocked down.
Okay. Another massive issue is women's health. Obviously, that has been and will continue to be a top issue in America, in Congress. How do you expect to see this fight play out in Congress in the next several months?
Well, we're going to keep talking about it for sure. We had, when you look at Pat Ryan's race in New York, and he won, talking about in upstate New York, women's reproductive rights, and it really goes to your freedom, period. It's almost bigger, but we're going to keep talking about it. We're going to keep talking about the contrast, and hopefully we can do something where we help the states that are safe havens, like Illinois is a safe haven state, and there's not a lot of those around us. And I know from speaking to Planned Parenthood and other people, we are overwhelmed with people coming to the state of Illinois, and we want them to keep coming, but there might be help needed or resources so that we can make sure that we deal with everyone in a safe way.
The GOP has floated a national ban. Do you believe the Republican leadership can stop with a national 15-week ban, or will their right flank and outside groups push for laws that extend even to IVF and contraception?
I don't think that they're going to be successful. First of all, thank God for Georgia. So I don't think it would, even if it passed in the House, but even in the House, I'm not sure. We're tight in the House, and I think that more moderate Republicans feel a little sense of freedom, I think, now. I don't want to speak for them, but I just don't think, they might push for it, but I don't think that it's going to go anywhere. We have now a majority, albeit slim, in the Senate, and then we have President Biden, so to stopgap, measures, I guess. But and I think that the groups have been so strong in making their voices heard, and I would, ask them, plead with them to keep doing that. Don't give up on the issue, make your voices heard, contact the people, that represent you and let them know how you feel. It is extremely important. People don't realize how important their voices are sometimes.
You have a lot of hospitals in your districts. What are you hearing from them on forestalling Medicare cuts, and do you agree with them? How do you balance their appeals from better off hospitals and some of your safety net hospitals?
Yeah, I am, and in my district, which is urban, suburban, and rural, I've had hospitals on the south side of Chicago close. I've had hospitals that won't deliver babies anymore. They're moving to other things. So I'm very, very concerned. And it's interesting you asked that question because I'm meeting with 4 of my hospital heads today. So I will have more information for you. But I am concerned for them. Healthcare is my second largest employer in my district right now. My district is changing drastically. In January, it'll be 2.5 times bigger geographically than it is now, so I'll have more hospitals and a VA hospital. So I am concerned for them. I do agree to an extent of what they're saying, but I do want to hear more from them. So I'm glad, we're having the meeting so I can advocate where necessary.
We're getting close on time. I wanted to just talk specifically about the lame duck. There's a lot of healthcare priorities right now. A lot of folks fighting for your attention right now. What are you concerned won't get done in the crush, and what are you really feeling optimistic about?
Well, we've done a lot of good things, already as far as, Medicare being able to negotiate and the cost of insulin and then out-of-pocket costs, and just want to, work to make sure those things get implemented and get implemented correctly. There's a lot of concern about the 340B, and I'm hearing from, a lot of my, particularly places like that deal with HIV and AIDS. So I'm hoping we can do something around that. I'm still hoping against hope for what we want to do with maternal mortality and morbidity. I'm hoping that we can get that across the finish line.
And then we'll get out your crystal ball for 2023. What do you expect is going to be some of the first healthcare priorities that rise to the top in early 2023?
I think we still have to work on making sure that everyone has health care and that there is access, and there's still work to be done around, how much it costs and that kind of thing. So I think working around those issues, hoping that, we look at clinical trials, because that's very, very important. And the other thing, which I'm not going to say I have the answer, I also think that we really need to work on how do we diversify the healthcare system, because it's so expensive to go to college period and then medical school. And the other thing that I hear from hospitals is the workforce. And I'm hoping that we can do something around all the immigrants that have come in. How do we let them work faster than we are letting them work? We hear from some of our colleagues from Texas that many of them are professionals and we can put them to work. So that's the other big thing I hear from hospitals is workforce development, but not even just hospitals, ambulance service, EMTs, paramedics, on and on and on. So I think that's something else we'll work on.
Great. Well, unfortunately, that's all the time we have for today, but thank you so much, Congresswoman Kelly. I appreciate it.
Introducing our View from the Top moderator and Axios publisher, Nicholas Johnston.
Good morning. Good morning. Thank you all for joining us today. Nothing that we do at Axios would be possible without our partners. The journalism we do, the events like this that we host, the delicious breakfast we get to eat, is all thanks to the sponsors we're able to work with. And so a huge thanks today for Pharma for helping make this event possible. So I want to welcome to the stage for a View from the Top conversation, Lori Riley, the Chief Operating Officer of Pharma. Lori, welcome.
Hello.
Thanks for being here. So we are finally done with the midterms.
Yes.
Looking back on it, how much role do you think healthcare played during the elections? Was it a referendum on any parts of the healthcare agenda?
No, I don't think it was. If you look at almost every poll that came out, the issues were driven by jobs, the economy, issues like abortion. Healthcare was pretty low on the list, honestly, about 7% if you look at the ABC poll. But if you kind of break that number down in terms of healthcare, I think there are two issues that do jump out for people. One of which is people feeling like they're spending a lot more on their insurance, but they're not necessarily getting what they expect to get. And the second is the ever-increasing cost of their premiums. So there are issues that people are focused on as it relates to healthcare. But in terms of this election, I think there were just other issues that rose.
I mean, is that a good thing? Is it a bad thing? Does it make it a little less partisan if it's not at the top of people's minds and people are fighting about that? It's more under the radar? Or do you wish it maybe was attracting more attention?
Well, I think there are issues that definitely do need to be solved in terms of healthcare. I feel like a lot of attention has been placed on prescription medicines over the last few years. Right. And obviously there was a large bill passed in August, but that bill didn't address a lot of the issues that we hear and that quite honestly shows up in public polls as it relates to what people are struggling with. And that is their out-of-pocket costs that are set by their insurance companies.
Yeah, we'll come back, I think, to the agenda, but I want to stay on the midterm just a little bit. With the last race yesterday, Warnock-Riding in Georgia, Democrats have a clear majority in the Senate. No power sharing agreements. Does that change your calculus at all at what might happen relating to the Senate on health care?
Well, I think it obviously changes things a little bit in terms of, one senator not having kind of complete control and ability to change the agenda makes their nominations obviously a lot easier. But with a Republican House, I think there's obviously still work. If anything's going to happen on health care, it's going to happen in a bipartisan way.
Right. The big accomplishment, a big legislation piece passed last year was the Inflation Reduction Act. There's some parts of it you're not very happy with, Medicare negotiation. What's next on that?
Yeah, well, obviously that bill is getting implemented and will be implemented over the next couple of years. And you're right, we've been concerned and still remain very concerned about that bill. And I would say for kind of three primary reasons. The first of which is what it does to future innovation, future research. Second, what it does to competition. Competition has been, with generics and biosimilars, has been critical to keeping costs down, and I think it creates a deterrent there. And then third is really the future of the Medicare Part D program. As it relates to the first one, I think it's undeniable that we will see fewer drugs as a result of the Inflation Reduction Act. Everyone from CBO to economists agree that that's going to happen. The question is just how many. But in addition to new medicines coming to market, the other issue that we are very concerned about is follow-on research that happens. If you look at oncology, for example, a lot of the research that happens in oncology happens after a medicine has actually been approved, made it to market. In fact, 60% of cancer medicines get an indication after they've been on the market 7 years or longer. The problem with this bill is if I'm a maker of an oral oncology medicine, at year 7 after I've launched, I may be told that my medicine is subject to price setting. And for that company, they're going to have a tough decision to make. Do I continue to invest in that therapy for other indications that many patients may be waiting for, knowing that, in fact, the government may come in and set the price of that medicine? And so that kind of research, which has been the lifeblood in oncology research, is a big, big concern going forward.
Well, this bill is law. So
Yes.
what are the steps you're considering as far as next steps, as adjusting that for implementation or encouraging Congresses to revisit?
Well, I think there's pieces of it that we would love for Congress to revisit. That may not happen over the short term, but areas like the disparity that exists between oral medicines, pills that you get at the pharmacy, which the law says the government can step in, set the price at 9 years versus biologics, which the government has to wait till year 13. The concern there being that it disincentivizes companies to make oral medicines, which quite honestly for many patients are preferable. So we would love to see things like that re-examined by Congress. Again, it may not be in the short term, but we will be working to educate folks in terms of what some of the significant drawbacks of this bill are and changes that could be made.
Is going to court an option you're considering?
I think anything is on the table at this point. I mean, we're still looking at those options, but I think right now, we are hearing from our companies. Our companies are talking in their investor reports about the kinds of decisions they're having to make. And I'm hopeful that some of those, decisions will be, assigned to those in Congress that maybe we didn't think about all of the unintended consequences.
Let's think a little short term. Now we're in the waning days of a Congress where everyone's trying to get something done in the last moments. Were there any things on the cutting room floor that you're keeping an eye on that might end up in the next month? I
think at the end of the year package, I would say one issue that we are particularly concerned about is the need for greater research into antimicrobials. COVID, I think, shined a light on just how many people were dying from secondary infections that they received as a result of COVID, but it's certainly not limited to COVID. Many patients who end up in the hospital end up with an infection that is resistant, for example, to antibiotics. And we've had a lag, quite honestly, in research and development, because if you get an antibiotic to market, the goal is that you actually shouldn't be using it. You should be holding that in reserve, because the more people that use it, the more resistance builds. So there is a bill, the PASTEUR Act, that we would love to see get included in the end of the year package, because it helps address and hopefully reinvigorates research and development for antimicrobials.
How optimistic are you?
Well, it's hard to say.
Hope springs eternal, and the trains leave the station.
The trains, I think there's a lot of talk, but again, we're competing with a lot of different things in an end of the year package. And
but that's your one top priority.
That is our top priority for this year, yes.
Right. So looking ahead to 2023, there's a new sheriff in town in the House.
Yep.
What is your view of what you can work with and your optimism about the Republican agenda in the House on healthcare?
Yeah, I think one thing is clear, and Republicans have said that they intend to do a lot of oversight. And I think there are lots of areas ripe for oversight. One of those is a thing that also got left on the cutting room floor as it relates to the Inflation Reduction Act, and that is the role of others in the supply chain, particularly pharmacy benefit managers and middlemen, who eat up a large share of the healthcare dollar as it relates to medicine. So So for every dollar we spend on a prescription medicine, the manufacturer retains 48 cents of it. 52 cents goes to somebody else in the supply chain. Many of those are middlemen like PBMs and insurers. There's a lot of work that could be done and a lot of oversight. Federal Trade Commission is one entity that's looking into those, and I think hopefully there'll be interest in Congress to drilling into that issue as well.
Yeah. So we've got just a little bit of time left. So for one last question, you mentioned in a divided Congress, bipartisanship is the only way something will get done. Where do you see the most fruitful places where you can get a House and a Senate, a Republican and a Democrat, an agreement to move forward on some of your issues?
Yeah, I think pharmacy benefit managers is an area where there has been interest from both sides of the aisle. Senator Wyden was an early adopter of a concept of what he had a bill called the See-Through Act, which would have passed rebates and discounts that our companies negotiate with insurance companies, pharmacy benefit managers. He had a bill to pass 100% of those rebates back to patients. We're big supporters of that bill. On the flip side, Congressman Carter, in the House has also been a very vocal critic of pharmacy benefit managers and some of the practices on pharmacies as well as from our industry. So we've seen leaders on both sides of the aisle, both House and the Senate, who have expressed interest in addressing this issue, and we think this is one that's absolutely ripe for attention.
So to keep an eye on where Republicans and Democrats can agree, that's the place to
I think that's right. I think over the next 2 years, we're going to have to find an area where there's common ground. We think PBMs could be one area for common ground.
Great. Lori, thanks so much for joining us today. Thanks for making this morning possible.
Absolutely.
Please welcome to the stage Axios healthcare reporter Caitlin Owens.
Good morning. I am Caitlin Owens. I'm a healthcare reporter at Axios, as you may have just heard. And I am thrilled to be here with you today. Our next guest is the congressman from Kentucky's 2nd Congressional District. He's also the Republican leader of the Health Subcommittee on the House Energy and Commerce Committee. Welcome to the stage, Congressman Guthrie.
Hey, thanks, Caitlin. How are you doing? Good to see you.
Good.
How are you today?
All right, Congressman, you and I first started chatting many years ago during a time you probably you either remember well or blacked it out, but ACA repeal and replace.
I remember well. Yeah, exactly. Yeah, repeal and replace. I remember the thumbs down in the Senate more than anything.
We'll never forget that. So the GOP's health agenda has evolved significantly since then in a different direction. Can you walk me through that evolution?
Yes. So obviously there's things that need to be done with the Affordable Care Act. We just had a bill pass in August that took $288 billion out of Medicare. Imagine if the Republicans had taken $208 billion out of Medicare and put it into subsidies for the Affordable Care Act. So it's not sustainable. It's like college tuition now. Prices keep going up. We subsidize it. It's pricing people out of the marketplace. So it still needs to be addressed. But when we put together the Healthy Future Task Force to look for the majority that we're going to have, we were hoping for then and that we have, that what can we get accomplished? And we didn't know what the Senate was going to be. I guess it's a clear picture now after last night. But we didn't know what the Senate was going to be, but we knew that President Biden was going to be president, and he's not going to sign a repeal and replace bill. So any kind of major overhaul of the healthcare system, that we're not saying it doesn't need to be done, but what we're saying is what can we get done over the next 2 years? And so we really focused on very important things we need to do. We can get into what we want to do, but that was kind of the evolution of the thinking. It wasn't that we don't have a Republican agenda moving forward. What we have is it's okay to get first downs in football. And you score touchdowns. If you get a lot of first downs, and it makes a difference. And so, having a complete overhaul of the system and spending 2 years and getting to a thumbs down or a presidential veto, if you could get to that point, is we just wanted to deal with reality. And it's time to get some things done.
Right. And so I do want to hop through those quickly, but the first one I want to touch on is price transparency. It was under the Trump administration that there was a price transparency rule. That was a couple years ago now. Just from looking through your materials, it sounds like you don't view that issue as resolved. It's not resolved. And the rules are different, and it's there's certain hospitals that will tell you they comply with transparency. I think it's difficult to put a price on a product. It's not simple as like you're going to produce a glass of water, so you know all the input costs. When you go to the physician just to get
You think you can say, what's a colonoscopy cost, whatever costs, and you got the anesthesiologist, you got the pathologist, you've got a lot of different packages. But I've had people call my office and say, just the other day, a guy called and says, I don't have health insurance. I get it. I didn't buy it, but I'm trying to get a simple procedure done. I can't get a price quoted to me. So I don't think we're there yet with price transparency. And it's important. I say that sounds like a first down, but if you get price transparency, it changes the marketplace. And when first got into this, how important really is this? If I'm out calling, how much does this cost? How much does this cost? How much does that change the system? But what's going to drive the system, if health employer-sponsored plans get access to pricing data and realize what they're paying for, and there was an example in the 340B program that was in the New York Times of a $25,000 drug that was sold to the hospital for $3,000 of the 340B. A private payer person bought it said the health insurance company paid $25,000 for a $3,000 drug. Well, the health insurance company didn't pay that. The employer who sponsored the plan paid that. And I spoke to an employer sponsor group. My family's in the automotive supply business, and I will tell you, if we sold a product to a buyer at the automotive company we deal with and had a 4,000% markup, that buyer would be fired on the spot. And so what we want to do is get transparency. So, and what's going to drive innovation and change and getting control of costs in the system, or I think are the major employer-sponsored plans. That's who's going to get it. Who surprisingly don't get access to the information you think they would.
Right. And do you see this as an area where legislation is needed in addition to that administration?
I think so, and so we need to have hearings to see exactly what it's going to be and what we can do in a bipartisan way. I think that's a bipartisan issue. We haven't really sat down. We're still kind of putting our, Kathy Morris Rogers is going to chair E&C. I could bet on that, but the steering committee meets actually today and start putting people in place. But once that happens, we're going to sit down with our Democrat counterparts and say, these are some things we want to get done. We think can be bipartisan, maybe the details. But I think that I really think price transparency in a real way, where people actually have, and I know we're limited time, but where this kind of came to me, I have an employer in my area. It's kind of a conglomerate. The biggest employer is a grocery store chain that bought other businesses, but they have a pharmacy, and they have a health insurance company, agency, and they have pharmacies. So they know what we as employers are paying because they have the health insurance, they have the information, they have the pharmacy, so they know what the pharmacy's getting. So they know what they're paying for a drug, but they know what's actually in the pharmacy. And they're saying, where's the delta between what we're paying and what the pharmacy is receiving? And that's what we want, to have people have access to the information, let the market work.
Right. And so you're touching on this now, but I view pricing transparency as step one, right? Like you have to do something with those prices.
Yeah, you do.
Is that a question for patients and employers, or is that a question for policymakers?
Well, I actually think that if you look at what employer-sponsored plans are paying, I'm talking the big guys, because there's so few people, but they're greatly affected by it because they're the ones really paying the full bill in the small market that can drive the prices. But if you get these big employer, particularly in regions where employers are, if you're in the automotive industry and you're in the healthcare industry in Michigan, you pay attention to what the automotive industry is doing. And so I think having access to the information is going to be what's going to drive it. And we need to see how that happens. I think, one, we need to make sure that people know what the prices are. And I will tell you, if I was a CEO of a major manufacturer, a major employer business, I had somebody tell me the other day, we were talking about this, that Jamie Dimon said they went into a group for his moving forward, and he said, we just couldn't figure out what the prices were and everything. So you got a major corporation like that based in New York that are struggling to find the information. I think we need to make sure that information's out there. The federal government's a big payer, so we have it's not just a pure market, and so we have a role to do that, and so we need to expose if the price is right, then that's what the price is. But my guess is there seems to be a lot of steps in the supply chain of healthcare, and we're not sure the value of every step.
Right. Moving on to a different element of the GOP agenda, oversight. Right. I want to hit first on COVID origins. That seems to be a huge interest of y'all's. What's the goal with these investigations? Do you think that it's knowable, at least within the short-term future, what the origins of the pandemic is?
I think we need to investigate, and we need to investigate. The purpose is to lead to legislation or information that we need to move forward. One of my biggest concerns as we look at what's moving forward is bringing trust back into our institutions. Mm-hmm. If you think about it, you have NIH, CDC, and if we have another pandemic, because the things that we already know that immediately, the very beginning of the COVID, Dr. Fauci and NIH immediately dismissed that it could have come from the Wuhan lab, to the point where they put out information that Twitter banned. You couldn't even put on Twitter that it could have come from the Wuhan lab because that's conspiracy thinking. We now know that it probably did come from the Wuhan lab. And so, we look at some decisions that were made, and and what was the reason for that? Why didn't the Dr. Fauci's of the world get on television and say, we just don't know where this came from? Because now we know there was no evidence. There was no evidence anywhere that said it didn't come from the lab. And so that's what we need to find out, and because we need to build trust in these institutions, because this may happen again. Hopefully it's every 100 years. I don't think we can depend on just because it was 100 years ago we had the Spanish flu, that it's going to be 100 years from now. And so when this happens, people need to know. So we're going to look at the CDC. They put out testing that didn't work. We know that they had some political influence in some of their masking decision with schools and education. And that just takes away trust from the American people. We need to know that the groups that are supposed to put forth science are putting forth science in so the policymakers can make decisions and the public can have confidence.
And so I've been curious, what if we find out without a shadow of a doubt that the virus did originate in a lab?
Right.
What should the American response to that be?
Well, we need to know, because a couple of things. One is just, how do you respond to future pandemics? Well, there's a couple of things. One, why did the World Health Organization seem to want to cover up that it was coming from China? So we give a lot of money to the World Health Organization. It seems like other countries must give money to it, expecting something in return. So what is the value in participating in some of these world organizations if you can't have faith and trust in moving forward? I think that's important to move forward. I'm not saying that we should pull out of that at all. But I think we need to know. We need to see reform in it if we're going to continue to fund organizations like that. But I think it's important to know, what reactions you're going to have to China to doing that. I don't know, but I think what you can do is look at it from the perspective of what role do we have in it? What is the role of gain-of-function research? What is the function of it? There's some question, can viruses eat bacteria, therefore the antibiotics? So there are things you have to be careful of, because there are people studying how viruses can get around the antibiotic issue, where antibiotics the bacteria becomes resilient against the antibiotic, that a virus can actually kill the bacteria. So there's studies moving forward in that, so we need to be acknowledging that, and not just come at carte blanche that you can't study viruses. But what we absolutely want to know is why was that going on? What did we participate in it? And I think the world just needs to know the answer, because it really has brought our world economic downturn, and it's important to know if other players are, for whatever reason, did that happen. My guess is it came from the lab, but I think it came out accident from the lab. I don't think it was intentionally leaked from the lab. But look what it's done to China. Look what's going on in China. Social upheaval because of what happened and their reaction to it.
All right, so with our last few minutes here, I want to talk about the Inflation Reduction Act. And specifically the Medicare negotiation provisions of those.
Right.
You have signaled that oversight of that implementation will also be a priority for the Republican Congress. What does that, let's start here. Does that mean repeal of the IRA is off the table?
Well, it gets back to, are you going to have the votes to repeal it in the Senate and the House? So do you want to fight that battle? I think we need to do oversight of it. If you saw the campaign moving forward, we were talking, watching television, and you see the president say, we've lowered prescription drug prices, And there's some debate whether that does that, because even CBO says you're going to have higher entrance prices coming in. But the question with that, what they didn't say we're going to lower prescription prices, and at the expense of lower price, you're going to pay less. If you accept that they're going to pay less, you're going to get less. And CBO said we're going to have less cures, less moving forward. So and quite honestly, the press never exposed that, okay, you're going to pay less if you accept that, but you're getting less for what you paid. So do you want less cures? And our side of the aisle wants more cures. And we really feel strongly if we could, getting this repealed in the next years is not going to, I don't think is in the cards. The one where the president signed that, I get moving forward. But we had what we called HR 19. That was over 30 specific bills that was designed to lower the cost of drug pricing by bringing competition, bringing biologics in quicker. I mean, that's how you deal with insulin. You bring alternative insulin. It's a biologic, so you have to bring biologics into the marketplace quicker, where you can have lower prices with more drugs and with more pharmaceuticals and more innovation. And we feel like I really was hoping that Build Back Better and the Inflation Reduction Act wouldn't pass for the reason that I thought that's the wrong direction, but the right direction is bringing more competition. I just met with a group yesterday that you can literally have different patents, and one was for rheumatoid arthritis, the other was for another patent for people who suffer with rheumatoid arthritis. And they said the problem is if you take one patent out, you got to fight the other. And they will probably get thrown out in court, but the question is, are we going to go fight? So, patent reform, those kinds of things to bring pharmaceuticals in the marketplace quicker is what we want to focus on, so people get lower prices and they get more choice instead of the other way around.
All right, last question, 30 seconds.
Okay.
What is the worst thing that could happen through implementation of Medicare negotiations?
Well, I think the worst thing to happen is you just get that. We've already seen one industry announce they're not going to do a phase 3 because they're not concerned about pricing going forward. That we start, the worst thing that happened, that hopefully doesn't happen, but it could, is we get less innovation in pharmaceuticals. It's amazing what's going on in pharmaceuticals these days, and we want more innovation, not less. And I'm afraid that's where we're going.
Congressman, we are out of time, but thank you so much for joining us today.
Thanks for having
I enjoyed
me.
our
Appreciate
conversation.
It. Appreciate it. Thanks. Appreciate it. Thanks a lot.
All right, next we're going to welcome our final guest of the morning to the stage. She serves as the Deputy Assistant to the President for Health and Veterans Affairs on the White House Domestic Policy Council. Had to read that one to make sure I got it all there. Please welcome Christen Young. Hi.
Good to see you.
You too. All right, Christen, thank you so much for joining us this morning.
To be here.
Let's start chronologically. Midterms are over, actually, as of last night. We're now looking towards the lame duck. As you know, there's a lot of potential policy riders that could go on any spending bill that passes. What are the White House's priorities when it comes to health care of what should make it into that package?
Sure. We, are working closely with both chambers as we enter this end of the year period. In terms of priorities, there's a number of issues we're tracking. There's, of course, key public health priorities that Congress is looking to deal with around FDA and other sort of key public health issues that we're paying a lot of attention to. There are your typical suite of Medicare extenders that are something that we need to pay attention to when we want to make sure that we are using this opportunity to strengthen the Medicare program and continue to ensure beneficiary access to key services and ensure that our providers are on stable footing coming out of a tumultuous last couple of years. We're also thinking a lot about ways to improve and strengthen the broader healthcare system and looking for opportunities to get some bipartisan work done there. And the last priority I would mention is mental health, which I think we'll talk a lot about today, but we have seen tremendous bipartisan interest in making meaningful progress on shoring up and expanding Americans' access to mental health services, and I think you could see some of that work getting done in the context of the end of the year legislation.
And we will circle back to some of that. But I want to move to Medicaid next. Whether during the lame duck or not, as most of you likely know, when the public health emergency ends, which policymakers expect it generally to be sometime next year, that will have huge implications for Medicaid enrollment. What is the administration doing and planning to do to make that process smooth and prevent a spike in the uninsured rate? And is there anything Congress needs to do?
Yeah, that's a great question, and obviously a tremendous area of focus. Once the public health emergency ends, whenever that does happen, the state Medicaid programs all across the country will engage in redeterminations of Medicaid eligibility for the first time in quite some time. We have been focused since day one of this administration on making that process as smooth as possible. And so over the last 2 years, we've really invested a lot of effort and resources in improving the ability of Medicaid agencies and healthcare.gov to communicate with each other and to communicate directly with enrollees to ensure that when coverage transitions need to happen, they happen as seamlessly as possible. We've been working closely with states on how they are conducting outreach to beneficiaries and the way they are engaging in the process of communicating with folks for the first time. And we've provided a great deal of guidance to states going, all the way back to 2021 on our expectations around how the eligibility redetermination process restarts and what states need to do to ensure that they are making accurate and fair eligibility determinations that treat enrollees fairly.
And you mentioned ACA. Right now, enrollment under the Biden administration, enrollment has significantly increased, in part because of enhanced tax subsidies. Do you have any prediction for how Medicaid redetermination will impact ACA enrollment?
So as we enter the phase of people potentially moving out of Medicaid coverage, many of the people who are moving out of Medicaid will become eligible for enrollment in coverage under the Affordable Care Act, and we are optimistic that many of those folks will find a home in ACA coverage, and we will be able to encourage folks to check out their options and enroll. Stepping back, we are incredibly proud of what we have seen on the Affordable Care Act and with respect to ACA coverage over the last couple of years. As you note, coverage is more affordable than ever before, thanks to 2 pieces of legislation that the president signed. And as a result of that more affordable coverage and the tremendous outreach coming out of federal agencies, we've just seen record-breaking ACA enrollment. We've entered this enrollment period with more than 14 million people enrolled last year. And we have announced that new consumers are up 40% this year compared to the same time last year. So we are really continuing to build on that and move the ball down the field and ensure that anyone in this country who's uninsured has an opportunity to get coverage that meets their needs at a price that works for them.
Let's move on to some more administrative actions. IRA implementation, the Medicare negotiation provisions. What are some of the biggest elements of that implementation process?
Sure. So the Inflation Reduction Act was obviously a tremendous victory for the president. We took on Big Pharma and we won, and we are proud to be embarking on a journey of implementing a set of reforms that are going to make prescription drug coverage more affordable for seniors and ultimately bring down the cost of prescription drugs. There are a couple of key pieces that are very top of mind for us, and I want to talk a little bit about the specifics and then a couple of words on sort of the values in the implementation. One of the biggest priorities for us right now is the change to the Part D benefit so that seniors will have a $2,000 cap on their spending at the pharmacy. Making that change inside of the Part D program is a complicated lift. It's an easy talking point, but there's a lot of work that needs to go on inside of CMS that involves both the pharmaceutical industry as well as the prescription drug plans themselves. And so that is a important area of work for us, and one that CMS is committed to moving out on quickly and efficiently and in a way that really works for beneficiaries. We are also hard at work setting up the bones of the process by which Medicare will negotiate prescription drug prices. As I think this audience knows, the law provides a fair amount of scaffolding about how Medicare should be engaging in these negotiations. And so we are not starting from scratch here. We are implementing a system that Congress designed where Medicare will choose a set of drugs, receive information from the pharmaceutical industry, and produce a fair price as part of this negotiation process. And so it's a major focus for us as we work to get that system set up and functioning in time to negotiate the first set of drugs.
And do you have a timeline for when we'll start seeing some of that come out next year?
So we have already started to see pieces of guidance coming out from the agency around implementation of some of the key provisions. And we should be seeing more guidance over the next year. The agency is very committed to communicating clearly with stakeholders, providing clear expectations about timelines for when particular pieces of information will become public, and really engaging in a meaningful back and forth about the operational considerations in particular. We are building something new that the federal government hasn't done before, and very mindful of the need to provide operational certainty to everyone involved and enable those communications to happen smoothly and without an undue administrative burden on the industry.
Do you expect stakeholders to take you to court over any of the IRA provisions?
I don't want to speculate about how how things will unfold. I will say we are committed to implementing the law in a way that is consistent with the statute, and delivers the benefits that Congress has delivered here for the American people.
I think it's obvious that this law will be criticized from the right. It already is, and we can expect that going forward. But what about potential complaints from the left, either about implementation not going far enough, once we do start to see some of those negotiated prices, or, and we'll get to this next, but about additional actions that they want to see on drug pricing?
Sure. I mean, in this town, people always have opinions about the work the administration is doing. As we go into this work, I will say we feel very proud to have signed this monumental piece of legislation that is going to transform things in really important ways for Medicare beneficiaries. And I think we are very much heads down, focused on implementing the law as Congress designed it, and making that work for the American people. At the same time, we aren't done on drug pricing. In October, the president signed an executive order directing HHS to develop new models at the Innovation Center that can continue to make progress on lowering drug prices. And so folks can expect to see more action from HHS on a broad array of prescription drug issues in the years to come, and we're going to continue to focus on those actions while we work to implement the Inflation Reduction Act.
Any preview of what some of those actions might be?
Not just yet.
And before one more question on drug pricing. So just some of the things that both legislators and other policy groups on the left are calling for: Martian rights, patent reforms, IP protection waivers for some of the COVID drugs. I mean, there's kind of a swath of drug policies that, are very much part of the conversation. Do you anticipate action on any of those?
Yeah, so I don't want to get ahead of any deliberative process inside the agencies. The president has been clear that he thinks Americans pay too much for prescription drugs, and this is an area of focus. And so this area remains a priority for us, and one we're going to continue to look at. First out of the gate, I think we'll see some work from the Innovation Center and a little bit of a charting a course there on the Medicare and Medicaid payment side, but there continues to be work to do.
And now let's circle back to mental health. You mentioned this is an area where there could be bipartisan legislation. What should that look like?
Yeah, this is a great question. Let me back up a little bit. In last year's State of the Union, the president outlined a mental health strategy that was focused on really three key pillars. The first is dramatically expanding our mental health workforce. We know that across the country there are not enough providers of mental health services. The second is making mental health care services easier for people to access by getting rid of cost barriers or convenience and other sorts of access barriers that keep people from getting the services they need. And the third is supporting community institutions and a social safety net that fosters resilience and mental wellness for people across the age spectrum. And I think you have seen a real bipartisan interest in all of those spaces. The need for workforce investments is very clear, and something that Congress has always been interested in a place where I think we could see meaningful progress. When it comes to access and cost barriers, really interesting work out of the Finance Committee over the last year around mental health parity, and ways to improve the cost environment for consumers, as well as around telehealth and other novel mechanisms of accessing mental health services. And of course, we have a bipartisan cornerstone in the CCHBC program, which enables access to high quality mental health services in communities. And then the third piece around supporting wellness and resilience in communities communities is one where I think we have already seen really interesting bipartisan work done in the Bipartisan Safer Communities Act, which is a meaningful investment in schools and young people and the mental health needs of our youngest brains. And so a place where we're proud to have signed legislation, and I think there is opportunity to continue to do great work.
What are some other areas that you see the potential for bipartisan work in healthcare?
Sure. So, I think there are a lot of public health priorities going into the PAPA reauthorization process next year, and a place where I am optimistic we can get some bipartisan work done. We continue to focus on maternal health and our maternal mortality and morbidity crisis, and see that as a place for bipartisan work over the coming year. And we think a lot about areas that are not specifically mental health, but touch mental health around suicide prevention and broader efforts to build communities and structures that support people in staying well and supporting their mental health.
This is probably our last topic, but I do want to talk about price transparency. Obviously, y'all are overseeing the implementation of regs on this topic. Congress is, as you might have just heard, contemplating doing further legislative action there. I'm curious for your thoughts on that. And then I'm also curious, price transparency, I said this with our last guest, it's kind of in my mind step one. If you have the prices, then something should be done with them. And I'm curious who you think should be the actor there. Is that a government question or a patient-employer question?
So there's a lot there. I'll try to be brief.
Got a minute.
Price transparency obviously has a long bipartisan history with important steps forward under both administrations and administrations of both parties and bipartisan congressional interest. A lot was done in the No Surprises Act at the end of 2020 that we are working to implement now, and so there's a great deal of work there, and we're going to continue to stay focused on that. You're absolutely right that step one is building the information, and step two is making it more accessible to people. And I think the entire healthcare system, government and non-government actors, has a role to play in that. There's a little bit of an analogy here in the way the Affordable Care Act implementation moved the ball down the field on provider directories, where we were able to sort of make information about provider directories more accessible in ACA plans in ways that I think we have had spillover effects more broadly. And I think some of that same story can be told on the price transparency side. And this is an area that's not particularly glamorous, but one where we're going to continue to keep our heads down and try to deliver wins for the American people.
Well, that was perfect timing. You did it in 1 minute. Christen, we are now out of time. Thank you so much for joining us.
Great to be here.
Online for tuning into today's conversation. Please be sure to subscribe to Axios Vitals, our daily healthcare newsletter, as well as our new subscription product, Axios Health Policy Pro. You can also subscribe to all the other Axios newsletters at axios.com. I'm Caitlin Owens. Thank you for being in this event. That made us all smarter, faster, and we hope to see you next time.